Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
1/3 of children are overweight or obese. Children's Health is on the front line of fighting the obesity epidemic. And joining me this morning are Dr. Sue Hubbard, award-winning pediatrician and medical editor of KidsDoctor.com, and Dr. Faisal Qureshi, Associate Chief of Pediatric Surgery at Children's Health and UT Southwestern. Thank you for being here.
Good morning.
First of all, I'm really curious. Children's obesity, why are the numbers rising so much?
Well, first, I think you need to know that obesity just means excess body fat. And it's really very simple. As you know, more calories in than calories out. And that's why people are becoming overweight and obese.
Okay, so your kid is a little bit plump, a little bit chubby. How do you know if it's an overweight problem?
Well, one of the things that when you go to your pediatrician, you notice that we plot growth curves. And on those growth curves, we look at body mass index. And your body mass index should kind of flatten for a while. And you don't want to see it going up when your child is in the 4 to 7, 8-year-old range.
Right.
Because that is a predictor for having obesity or overweight problems over time and later in life.
Okay, so Dr. Qureshi, this isn't just about looks. This is about health, because there are diseases associated with being overweight.
Absolutely. Broadly, there are two areas of illnesses associated with obesity. The first are the physical. Your diabetes, high blood pressure, high cholesterol, even increased risk of cancer. The second are emotional and psychological. Did you know that obese people are twice as likely to die from illness and self-inflicted injury than non-obese patients? Obese kids are destined to become obese adults 80% of the time. So we have to tackle this in childhood so we can reverse these issues and we can prevent these issues.
I was just reading something the other day about obesity being so much as genetics and things like that, and there are some people who turn to bariatric surgery. Is bariatric surgery something that is practical or advisable for a child?
So weight loss surgery or bariatric surgery is very effective in teenagers and adolescents. If they've attempted weight loss and haven't been successful, weight loss surgery, and specifically the laparoscopic sleeve gastrectomy that we offer, is very successful. 60% of that extra weight can go away. Now, we're very selective in who we choose, give the operation to. We want them to be successful. They have to be over 14. They have to understand the procedure. They have to understand the work that is needed before the surgery and after the surgery.
Right. Parents play an incredibly important role in modeling how to keep weight under control, right?
Correct.
Absolutely. You're so right. Often the patients that come to see me have obese parents or parents who've had the surgery themselves. Everything begins at home, very early on.
So what do you do at home?
So simply put, eat less, eat mostly plants, drink lots of water, and exercise. Easy for me to say, right?
Yeah.
But parents and their families are dealing with all these pressures, and good nutrition is very low on their priority. So what I would recommend is, one, speak to your pediatrician and set caloric goals for your child. Secondly, speak to your nutritionist. See what you're doing right and what you're doing not so right at home.
Children's Health is on the cutting edge of a lot of different technology, and you're piloting a program right now that monitors a patient remotely?
We're so excited about this program.
What?
So after surgery, the patients check their weight, blood pressure, and heart rate on a daily basis. That information is sent to me remotely through secure internet connection. I monitor it. We also ask questions. The system asks questions. How are you doing? How's the eating going? How's the drinking going? If we identify a problem, the system alerts me and I call them right away. What this does, it prevents kids from missing school, parents from missing work. I can follow them remotely. And our early analysis shows that patients who follow the remote patient monitoring lose weight more effectively after surgery.
Technology is a pretty cool thing. Dr.
Healthy
Sue.
screen time.
Healthy screen time. Healthy screen time. That's
Healthy
very good.
screen
Okay.
time.
Real quickly, Dr. Sue, how do you get families off to a healthy start?
I think, just like Dr. Qureshi said, you've got to lead by example. You need to make sure that you're having good family activities. Make fun things to do. Go outside and move. Less screen time for sure, because we know that kids who are sedentary consume more calories.
All right.
And then be sensitive to your child. Know what their needs are.
Thank you so much, especially this time of year. This is an important thing. Thanks so much.
Thank
Go
you,
to childrens.com for more expert advice on keeping your family healthy. You can also follow Children's Health and the Kids Doctor on Twitter and, of course, on Facebook.
Just like you're always by your child's side, we're Children's Health, and we're by your side. Visit any of our 40 locations for exceptional pediatric care.